Hello, welcome to this FIP CPD Bite on what I like to call the self-care's secret role in healthcare sustainability. My name is Luis and I'm a pharmacist working in public affairs at ASGP, the association representing the self-care industry in Europe. Over the next minutes, I hope to give you a clear sense of how self-care is not only a tool for individuals, but also a driver of more resilient and sustainable health systems. The self-care's secret role for today has some learning objectives. These are to understand the concept of self-care as a driver of sustainability, and also to identify the opportunities for pharmacists to engage with self-care as part of the strategies to enhance that sustainability. Here's a quick roadmap. Think of this as the film poster for our session. Each section borrows a movie title from my favorite films. We open with the premise why self-care operates quietly at the base of the system. Then we'll locate self-care on the healthcare pyramid and explain how a strong base reduces pressure higher up. On 3, we'll walk through the regulatory transition and what a responsible switch delivers for safety and access. After that, we shall uncover the often invisible savings and productivity gains from responsible self-care. Then we'll examine topical antimicrobials as a practical example, including the risks of reverse switching, and we shall close with the lessons learned and the role that pharmacists can play. Finding self-care. At the base of the healthcare pyramid is self-care. These are everyday actions, prevention, and responsible use of OTC treatments. A robust base lowers demand on primary and secondary care, improving access for those who truly need higher level services. The same happens for the costs. You see, in Europe, self-care includes prevention, self-diagnosis, and self-management of many common conditions. The availability of OTC options and pharmacist guidance determines how effectively people can practice self-care. Too often, it's taken for granted. Self-care is already delivering significant value across Europe, easing pressure on healthcare systems, generating substantial savings, and empowering individuals to manage their health. Self-care includes the everyday products millions of Europeans use to stay well or to bounce back quickly, such as non-prescription medicines like painkillers, cold and flu remedies, allergy tablets, antacids. It includes also food supplements like vitamin D, B12, magnesium, iron, and it includes medical devices too, like condoms, lubricant eye drops, and a humble but heroic Band-Aid. These tools empower people to take health into their own hands. In 2024, Europeans purchased over 4.7 billion packs of non-prescription medicine and 1.3 billion packs of food supplements, supporting their health without leaning on already overstretched healthcare services. The switch, the regulatory transition for safety and sustainability. The switch from prescription to OTC medicine is a regulatory decision grounded in safety and evidence. Regulatory authorities will gather around a supplied evidence and approve the change of prescription status. When done responsibly, it increases access, empowers people, and it frees clinician time. All of these are contributing to sustainability. If ever problems arise from a product available as non-prescription, authorities can always bring a product back under the control of prescription through what we commonly call a back switch. So there are some general requirements to apply to the non-prescription status. Here in Europe, you cannot apply if substance is new, with little market experience and safety data, if it is to be used as an injectable, if there is the slight chance to generate abuse or if it's easily misused, and if the substances can pose a direct or indirect danger, for instance by masking symptoms of a serious disease. To request a switch, companies can apply directly with a product of which they are marketing authorization holder, or, as we see in some countries, there can be a governmental decision to widen access to some common safe medications, and they will eventually do it by publishing a list of APIs that will become non-prescription from a fixed date onwards. There are some common indications for which we use self-care products, and each responsible switch expands this safe self-management option. There are a series of these common indications on the board, and the general movement is to go from short-term acute indications that were easily self-diagnosed into the territories of long-term conditions, and has a support to non-communicable diseases that might require a healthcare professional diagnosis prior to the patient's self-management. But there's the catch. Access to self-care still depends on where you live. A nasal spray or antifungal cream that you can buy freely in one country might require a prescription in another. Some products are generally available as OTC when you travel or go abroad for work, but others will depend on local culture, population needs, and organization of the health system. And now we go deep into the hidden figures. The self-care savings are often invisible, but they are quite substantial. These involve reduced physician visits, lower public spending, and less productivity loss. These hidden figures translate into real system resilience and better patient flow. ASGP ran a study to find out how much patients were saving by solving a self-treatable condition by going to a pharmacy to get advice and get self-care products, as opposed to how much it would cost to go to a clinic or a hospital. As expected, the results show that there are more costs involved, either for the patient or for the health system, when unnecessarily visiting a general practitioner or a medical specialist. According to the country, these fees will vary. And in the end, we even observe that non-prescription medicines are recommended by the doctors, while some others preferred prescription alternatives for the same condition. But this could be linked also to the reimbursement opportunities thereof. At ASGP, we also studied what would happen if non-prescription medicines were not available, or if self-care was not an option. And these costs were not counted in the figures that I showed you before, but look closely. Each individual would have to spend, on average, 106 minutes more traveling, waiting, and being treated by a general practitioner doctor. On the other hand, in Europe, we would need 120,000 additional doctors, or each of the existing doctors would have to work an extra 2.5 hours every day. Let's see what happened when we projected these numbers into the future. If we were to enlarge the self-care portfolio and increase the number of non-prescription medicines available. ASGP found that the whole European population would save 1 billion hours per year that they could dedicate to work or to other activities. At the same time, 58,000 doctors would be freed for other tasks or for further education and training. This is the equivalent of an extra hour per day per doctor that could be important to devote to patients with more serious cases. It looks complicated, but it's not. We also looked into how the different European countries have a very different amount of non-prescription medicines available, like Croatia with under 60 references, while the UK has over 140 active pharmaceutical ingredients available without prescription. In the graph, this is represented by the X value, and on the Y value, we have a country rating based on a series of factors that indicate how much people are willing to take self-care and to self-manage their conditions. So we see that there is ample opportunity not only to work on the self-care portfolio, but also on increasing health literacy to empower patients to make safe options regarding their health. We also look specifically into the antimicrobials that are available legally without prescription, dispensed in pharmacies for self-treatable conditions. These antimicrobials obviously comprise some antibiotics, antivirals, antiparasitics, and antifungals, and we decided to take a good look into the antivirals and antifungals. In Europe, we use these non-prescriptions antivirals in cases of lip herpes, cold sores, mouth ulcers, or warts. And we use a wide range of antifungals for several fungal infections like athlete's foot, dandruff, or ringworm. These treatments are all local and topical treatments. And at some point, AMR concerns were wondering whether these products should remain non-prescription. The fact is that most concerns within AMR apply to bacterial infections and to antibiotics. Antifungals and antivirals have very different action mechanisms and are less prone to raise resistant strains. At ASGP, we also gathered the evidence regarding the health value of treating these infections timely. The availability of these non-prescription medicines to treat infections help people take timely action and avoid the exacerbation of these conditions or even the transmission of the infection. By enabling the rapid care, these treatments lead to quicker and better health outcomes and lower the incidence in the population by also reducing the transmission. And because people can access self-care products instead of unnecessarily seeking medical advice, visits to health facilities decrease, resulting in a reduced burden on healthcare systems and freeing doctors for more complex conditions. As a consequence, healthcare-related spending decreases as well as the waiting times. And beyond the benefits linked to the healthcare system, society is also spared its indirect costs, such as the loss of productivity of individuals due to time lost in the event of disability and in seeking outpatient care. We went in deeper. We also ran a survey to understand what would people do if antimicrobials were prescription only. You see there below in blue, around 4% of the population would actually do nothing and wait for symptoms to wear off. Little less than 30%, there in green, would prefer to have an alternative treatment available for self-purchase. And as expected, the majority of the population, marked in pink, would eventually visit a doctor to get the needed prescription. And you see that this would amount to 59 million additional doctor's visits in a single year in already overstretched health systems. Paradoxically, we also found that the use of antifungal and antiviral medicines would increase if they were not available without prescription. And this is because letting the situation develop while waiting for an appointment would make the condition worse and require more potent antimicrobials, systemic use of antimicrobials, and lengthier treatments. The numbers are staggering, and I will leave them here for you for your free consultation. There are consequences of the delay in seeking care. There's an additional burden and extra costs for the health systems. There's productivity loss for individuals, and then the paradox of the increase of use if products were back switched. And now for the final cut. Self-care is a practical pillar of sustainable healthcare, as you have seen. It helps alleviate the strain on healthcare systems. It saves money for both individuals and the healthcare systems. It provides quicker treatment options, and it helps to free time on a scarce healthcare workforce. These self-care practices are better supported by pharmacist advice. They are available in pharmacies that are closer to populations like no other health unit. They help empowering citizens and healthy aging, and they are available also to prevent illness and the escalation of minor issues. So, self-care needs to be embraced as an essential and not optional part of our health ecosystem. For more details, please see the ASGP and FIP resources listed on the slide, including the ASGP analysis of non-prescription antimicrobials and recent economic studies that we have developed. I will also leave you with some further reading suggestions. Thank you so much for listening, and I hope this CPD Bite helps you see self-care both as a lever for further professional action and a strategic pillar of more sustainable health systems.